Welcome back to the channel where medical topics are made simple. In just 9 minutes, you're going to understand what you need to know for subarachnoid hemorrhage. We're going to cover the causes, pathophysiology, definition, and more. This video has a couple memory tricks, so make sure to watch it all. You can find this topic in our book and follow along, which is linked down below. You can also find the notes for this video linked down below. So what is a subarachnoid hemorrhage? A subarachnoid hemorrhage is bleeding in the subarachnoid space surrounding the brain. Oftentimes the bleeding is from a ruptured brain aneurysm. We're going to talk about aneurysms and the subarachnoid space shortly. A subarachnoid hemorrhage can be abbreviated SAH. A subarachnoid hemorrhage is a type of stroke. Specifically, it's a type of hemorrhagic stroke. Remember, there are two main types of strokes: ischemic, which is caused by a blockage in a blood vessel, and hemorrhagic, which is when there is bleeding inside or around the brain, typically from a ruptured blood vessel. A subarachnoid hemorrhage is a specific type of hemorrhagic stroke. Now, we said a subarachnoid hemorrhage is bleeding in the subarachnoid space surrounding the brain. So what is the subarachnoid space? Let's take a closer look at that. If we zoom in on the brain, we can see the brain is surrounded by protective membranes. These protective membranes are called the meninges, and they're located between the brain and skull. So if you look at the definition, the meninges are three protective layers of membranes that cover the brain and spinal cord. The three layers from outer to inner include the dura mater, arachnoid mater, and pia mater. The way to remember this is to use the mnemonic, "Skulls defend and protect brains." This mnemonic is perfect because it tells us to start at the skull and end at the brain. It also tells us the function of the skull and meninges is to defend and protect the brain. So the skull in the mnemonic tells us to start at the skull. Then we're going to move inward. The D for defend will help us remember the D for dura mater, which is the tough outermost layer. The A for and will help us remember the A for arachnoid mater, which is the web-like middle layer. The P for protect will help us remember the P for pia mater, the delicate innermost layer. And the word brain in the mnemonic will help us remember brain. The space we care about for subarachnoid hemorrhage is between the arachnoid and pia. This is called the subarachnoid space. Remember from our medical terminology video, the prefix sub means below. So the subarachnoid space is below or deep to the arachnoid mater. In other words, it's between the arachnoid and pia mater. Now this is important, so listen up. The subarachnoid space contains two main things you need to know. It contains the cerebral spinal fluid, or CSF, and it contains the major cerebral arteries. The CSF helps cushion the brain, provides buoyancy, and helps deliver nutrients and remove waste. The major cerebral arteries provide oxygen to the brain. We said earlier that a subarachnoid hemorrhage is when there's bleeding in the subarachnoid space. We now know there's cerebral arteries that travel through the subarachnoid space. So if one of these arteries ruptures or breaks open, then that can lead to a subarachnoid hemorrhage. And this is exactly one of the causes of a subarachnoid hemorrhage. So let's talk about those causes now. The easiest way to think about the causes of a subarachnoid hemorrhage is to split them up by traumatic and non-traumatic categories. Traumatic means the subarachnoid hemorrhage is caused by some kind of trauma. This could be a car accident, fall, or head injury. Non-traumatic or spontaneous means the subarachnoid hemorrhage was not caused by trauma, but from some other medical condition. This could be a ruptured brain aneurysm, arteriovenous malformation, or artery dissection. Let's talk about the causes and pathophysiology of both types, starting with traumatic causes, and then there's a memory trick at the end to help you, so keep watching. The first category is trauma. Trauma to the head can cause a subarachnoid hemorrhage. This could be from a car accident, fall, or head injury, to name a few. The traumatic event can cause blunt or penetrating trauma to the head. This trauma to the head can result in injury to the cerebral arteries. Remember we said the cerebral arteries are located in the subarachnoid space. Injury to these arteries can lead to bleeding into the subarachnoid space. This can cause a traumatic subarachnoid hemorrhage. But there's also non-traumatic causes Let's look at those next. This is important, so listen up. The most common cause of a non-traumatic subarachnoid hemorrhage is a ruptured brain aneurysm. Make sure you know this. Again, remember we said the subarachnoid space contains cerebral arteries. The cerebral arteries can develop an aneurysm, which is a bulge or ballooning in the wall of the artery. Cerebral aneurysms are typically saccular or berry aneurysms. If the aneurysm ruptures or bursts, then there can be bleeding into the subarachnoid space. This can cause a non-traumatic subarachnoid hemorrhage. This is also high yield, so listen up. The most common locations for a cerebral aneurysm are shown. You need to know this for your exams. The most common locations for cerebral aneurysms are in the circle of Willis. The circle of Willis is a ring of connected arteries located at the base of the brain inside the subarachnoid space. Common locations for cerebral aneurysms include the anterior communicating artery, posterior communicating artery, and the middle cerebral artery bifurcation. Note that the MCA bifurcation is technically a distal extension to the circle of Willis. As we mentioned earlier, a ruptured cerebral aneurysm is the most common cause of a non-traumatic subarachnoid hemorrhage. Other non-traumatic causes include an arteriovenous malformation, or AVM. This is a direct connection between arteries and veins that bypasses the capillaries. This causes vessels to weaken and potentially rupture. A rupture can lead to bleeding in the subarachnoid space, and this can cause a subarachnoid hemorrhage. Another non-traumatic cause is artery dissection. A dissection or tear involving an intracranial artery or an artery inside the skull can cause the artery to rupture into the subarachnoid space. This can cause a subarachnoid hemorrhage as well. Here's a quick memory trick to remember the causes of a subarachnoid hemorrhage. You can use the mnemonic BAT. The B stands for brain aneurysm, the A stands for AVM and artery dissection, and the T stands for trauma. So what are the risk factors of a subarachnoid hemorrhage? Well, this is easy to remember if you think about the causes. We said there are traumatic and non-traumatic causes of a subarachnoid hemorrhage. So the risk factors for a traumatic subarachnoid hemorrhage would include situations that put an individual at risk for head trauma. This may include car accidents, falling and hitting your head, or other head injuries. We said non-traumatic causes of a subarachnoid hemorrhage include cerebral aneurysm ruptures, AVMs, and arterial dissections. As a result, factors that predispose individuals to developing cerebral aneurysms, AVMs, and dissections are risk factors for non-traumatic subarachnoid hemorrhages. This would include smoking, hypertension, congenital defects, genetics, and family history, to name a few. This is important, so listen up. You'll likely be tested on this. Individuals with autosomal dominant polycystic kidney disease are at increased risk of developing brain aneurysms and are therefore at increased risk of a subarachnoid hemorrhage. Make sure you know this association between polycystic kidney disease and subarachnoid hemorrhage. We're going to talk about the symptoms and diagnosis in the next video, so make sure to watch it. It's linked down below. If you found the video useful, please hit that like button and let us know in the comments. You can find the notes for this video, along with our book and flashcards, linked down below. Subscribe to save time studying and not miss out on future videos and notes. Thanks for watching, and hope you return for future videos.